Right, so we're just going to run through these questions, right? And maybe just give a summary of embryology and histology, right? Things that you just have to take note of, is it? So this is the gross part. All right, so our first question comes concerning the vessels of the upper limb. The basilic vein arises from the lateral end of the palmar venous network. That is false, right? The basilic vein arises from the is the medial end of the dorsal venous arc. So you have a dorsal venous arc that will give rise medially to your basilic vein. That will actually ascend in the medial aspect of the forearm, remember? And then at the level of the cubital fossa, the basilic vein is going to receive a tributary of the median cubital vein. And then at the medial half of the upper arm is going to pierce the deep fascia to enter the deep component of the arm. And then at the lower border of the teres major, it's actually going to receive tributaries of the vena commutantes of the brachial artery, forming the axillary vein, right? And then the axillary vein enters your axilla, and so forth. So the basilic vein arises from the medial end of the dorsal venous network. Good. B, the subscapular artery is the largest branch of the axillary artery. That is true. Remember, the axillary artery divided into three by the pectoralis minor muscle. The first part gives one branch. That's your superior. That's the superior thoracic artery, and the mid part that is underlining behind the pectoralis minor is going to give two branches: your thyroacromial branch and your lateral thoracic artery. And then the last third, which is your third part of your axillary artery, it's actually going to give three branches. So just know, first part give one branch, second part two branches, third part three branches. So the branches in the third part, you're going to have one, the subscapular artery, which is the largest branch of the axillary artery. So the subscapular artery will actually descend and actually further bifurcate, and it gives your thoracodorsal artery, which is your artery to your latissimus dorsi, and your circumflex scapular artery. Remember, we have the triangular space. Yes, so that circumflex scapular artery will actually be a content of the triangular space. So the subscapular artery is the largest branch of the axillary artery. True. C, the cephalic vein pierces the claved pectoral fascia to empty into the basilic vein. What do you think? Yes, that is false. Why? They said basilic vein. Basilic vein, no. So let me just take you through the course of the cephalic vein. So the cephalic vein is a continuation of the lateral dorsal venous arc, right? It's actually, so from the lateral venous arc, right, it enters the anatomical snuff box, being the content of the anatomical snuff box. Then it rises lateral to the forearm, right? And then around in the superficial layer of the cubital fossa, it's going to give a branch which is called the median cubital vein. Take note, the median cubital vein is a branch of the cephalic vein, not the basilic vein. You understand? And then the cephalic vein will actually ascend entirely in the superficial layer, does not pierce the deep fascia. And then it enters the deltopectoral groove, right? Around at the infraclavicular region, it's actually going to pierce the claved pectoral fascia, right? So it's going to pierce the claved pectoral fascia with four things. So four things pierce the claved pectoral fascia, right? The following: one, the cephalic vein itself; two, the infraclavicular efferent vessels; three, the lateral pectoral nerve going to the pectoralis major; and then four, the thoracoacromial artery. So those are the structures that pierces the claved pectoral fascia. Done. D, the radial artery is a larger, more medial terminal branch of the brachial artery. What do you think? That is false, right? In the cubital fossa, the brachial artery will bifurcate at the level of the neck of the radius into the ulnar artery and the radial artery. The ulnar artery is medial, the radial artery is lateral, and the ulnar artery is larger than the radial artery. You understand? So that question is false. Good, guys. E, the apical group of lymph nodes receive the efferent vessels of all the lymphatic lymph nodes. The apical group of lymph nodes receive the efferent vessels of all the axillary lymph nodes. What do you think? That is true. Right. So remember, you have an axilla and you have 5 axillary lymph nodes given by the mnemonic apical. It's very easy. So you use the mnemonic apical. So the first A is going to be your anterior axillary lymph nodes situated at the lower border of the teres minor muscle, undercover the posterior to the pectoralis major, right? So the anterior axillary lymph nodes will actually receive about 75% of lymph from the breast, right? That's another thing that you have to take note. And then this P stands for the pectoral group. Pectoral group, they can also be called subscapular group. Why? Because they are sitting on the lower border of the subscapularis muscle. These, they receive lymph from the back above the iliac crest, right? And then the I, that's your infraclavicular lymph nodes. So take note, the infraclavicular lymph nodes, they drain all the lymph of the upper limb in the lateral aspect of the upper limb. So from the lateral aspect of the upper limb going up, you're going to have your cephalic vein, right? And the cephalic vein is going to be surrounded by these lymph nodes, right? That will actually drain in the deltopectoral groove into the infraclavicular lymph nodes. So in the deltopectoral groove, you have the infraclavicular lymph nodes that will drain lymph from the lateral aspect of the upper limb. Done. C, that's your central group, right? So central group is at the center from the word, right? It receives lymph from the following: from the anterior axillary lymph nodes, posterior axillary lymph nodes, and the lateral axillary lymph nodes. And then it is from the central when lymph will go to the apical. And then you're going to have the L, that's your lateral group. And B, the lateral group of lymph nodes drains the major lymph from the upper limb. But not all the lymph, because some of the lymph in the lateral aspect will actually drain in the infraclavicular lymph nodes. You understand? So the lateral group is going to drain the following. Remember, on the cubital fossa, you're going to have what you call supratrochlear lymph nodes that will actually drain lymph from the middle finger, or the lateral 3 fingers, right? The lateral 3 medial fingers, right? They will drain into the supratrochlear lymph nodes. And then from the supratrochlear lymph nodes, they're going to drain in the lateral group of the axillary lymph nodes. So I have summarized all the lymph right there for you. So all this lymph, they'll actually drain. Lastly, they'll drain into the apical lymph nodes, right? So since we are going to talk about you are also doing thorax, so it is from the apical lymph nodes where we drain into the subclavian lymph trunk. So the right subclavian lymph trunk would drain into the right lymphatic duct. Remember the right lymphatic duct that actually drain lymph from the right portion of the head, right portion of the neck, and right arm, upper arm, right? And then the left subclavian lymph trunk would drain into the thoracic duct at the confluence between the internal jugular vein and the subclavian vein, forming the left brachiocephalic vein. Is it? All right. So we are done with the first part. So I hope we are all together. I hope you are all together. Now, question 4. Concerning the brachial plexus. A, its cords lie in the posterior triangle of the neck. Its cords lie in the posterior triangle of the neck. True or false? False, right? You only have the roots, the trunk, and the divisions lying in the posterior triangle of the neck. And the cords in the terminal branches lie in the what? Axilla. That is false. B, its posterior cord gives rise to the axillary nerve. What do you think? That is true. Remember, the posterior cord is the largest cord. It receives all the posterior divisions from the upper trunk, middle trunk, lower trunk, forming the posterior cord. The posterior cord will actually give your radial nerve, which is the largest, largest nerve, right, of the brachial plexus, and it actually also gives the axillary nerve, which will supply the deltoid muscle together with your teres minor muscle. Good. See, all of its terminal branches lie lateral to the third part of the axillary artery. What do you think? That is very false. It's the first part. It's the first part, not the third part. You understand? So you're going to have the third part. You have the terminal branches, right? They are not lateral. Actually, you're going to have some, they're going to be posterior, some they're going to be medial, some they're going to be lateral, right? But the first part of the axillary artery, the brachial plexus cords, they will lie superolateral to the first part, not the third part. Done. D, it is enclosed in the axillary sheath with the axillary vein. We are talking about the brachial plexus here. That is what? That is true. So in the axillary sheath, it's a sheath of fascia that continues with your prevertebral fascia, right? So it continues and it actually accommodates the following: axillary vein, which is always medial, axillary artery, and the and the brachial plexus, together with the lymph nodes. Done. E, damage to its upper trunks results in elbow to chain palsy. That is what? That is definitely, that is true, right? So damage to the upper trunk, you have elbow palsy or a policeman tip or a waiter's tip, right? Then damage to the lower part, you're going to have a complex lesion. Is it? Done. Number 7, with regard to the shoulder joint, it is a synovial joint. True. So the shoulder joint is a synovial ball and socket joint between the 1/3 of a sphere head of the humerus with the glenoid cavity, which is deepened by the fibrocartilaginous glenoid labrum. You remember, right? Good. So that question is true, definitely. B, its synovial membrane forms the subacromial bursa. Its synovial membrane forms the subacromial bursa. That is false. Right. So most of the people, they confuse this part. So let me just summarize, right? So on the shoulder, on the shoulder guide, you're actually going to have what you call the subacromial bursa. So the subacromial bursa, it is going to be a bursa that is between your acromion. So you remember you have your supraspinatus, right, coming from the supraspinous fossa, attaching to the upper impression of the greater tuberosity. So this tendon, it actually moves behind or under the acromial process of the scapula. So you actually have a bursa that will be separating the acromion from the supraspinatus tendon. That's your subacromial bursa, which we said, if you remember from rotator cuff muscles, you can actually have subacromial bursitis, which is inflammation of that bursa due to wear and tear. You understand? Good. And then you have what you call subscapular bursa. So you have remember the subscapularis muscle attaching the lesser tuberosity of the humerus. So behind the subscapularis muscle, you're going to have the subscapular bursa, and this bursa communicates with the synovial membrane of the shoulder joint. I think I've summarized, right? So the synovial membrane forms the subscapular bursa, not subacromial bursa. So that becomes false. C, it is flexed by the anterior fibers of the deltoid muscle. What do you think? That is true. So your anterior fibers of the deltoid muscle actually flexes what? Your shoulder joint. Is it? Good. D, it is supported inferiorly by the transverse humeral ligament. That is false. So inferiorly, it's always a must to know that the shoulder joint is deficient inferiorly. You understand? It's deficient inferiorly. That's why the inferior dislocation, the are what are common, is it? So this transverse humeral ligament is the ligament. Remember, you have the bicipital or intertubercular sulcus. So this is the transverse ligament that will actually convert that bicipital groove into a foramen for the long head of the bicep brachii. E, the teres minor lies anterior to it. Does the teres minor lies anterior to the shoulder joint? That is false. That is false. So remember, you have the seats, right, for the rotator cuff muscles, and the T is for the teres minor, not the teres major, which actually attaches to the greater tuberosity, which is posterior. You understand? Good. Are we together, guys? Are we together? Right, so let's go to question 10. So with regards to the axilla, its content and its contents. A, it is a pyramidal. It is pyramidal in shape. That is true. You have your apex, your anterior, posterior, lateral, medial border, as well as the base. That is true. B, the latissimus dorsi and the teres major forms part of its posterior wall. That is true. So the posterior wall, you're going to have your subscapular wrist muscle, your latissimus dorsi muscle, your teres major muscle forms the posterior wall, right? That becomes true. C, the axillary vein lies outside the axillar sheath. What do you think? Definitely that is false. The axillary vein, the brachial plexus, and the axillary artery, together with the lymph nodes, actually lies into the axillary sheath. Right. D, the axillary artery gives off the lateral thoracic artery as its largest branch. That is what? Very false. We said the subscapular artery is the largest branch. But rather, it's very important to understand that the lateral thoracic artery, together with the thoracoacromial artery, they are actually branches that will supply your breast. Very important, right? And if you remember the lateral thoracic artery, you have your lateral thoracic vein. The lateral thoracic vein, that's the lateral thoracic vein. If you remember very well from abdomen, is the vein that will actually communicate with the superficial epigastric vein, forming the thoracoepigastric vein. You remember? That will actually result into a post-portocaval systemic anastomosis. That if someone has a hypertension or a liver cirrhosis or a liver fibrosis, you're actually going to lead to what you call caput medusae. And you can actually see the bulging and the dilatation of those vessels. Very important. E, the axillary nerve can be injured in inferior dislocation of the shoulder joint. What do you think? That is actually true, right? So inferior, if you actually see, you actually have the axillary nerve together with the posterior circumflex humeral artery, which is a branch of the third part of the axillary artery, winding around the cervical neck of the humerus, entering the quadrangular space. You remember? So inferior dislocation which are common of the shoulder joint, you actually damage the axillary nerve. And damage to the axillary nerve will lead to loss of shoulder contour, and which we call flat shoulder, is it? Because of the atrophy of the deltoid muscle. Good. Done. Let's